Welcome back. Now to the latest on coronavirus. A new study debunked the drug Ivermectin as the BA.2 variant spreads. Now we're joined live by Dr. Jeff Pothof from UW Health. Doctor, thank you for being here. Want to start with the BA.2 variant. It's now the most dominant strain of COVID. What do we know about the subvariant? Are we likely to see another?
I think what we know about this subvariant is it's very similar to Omicron, except for it's more contagious. So that means, shorter periods of time in contact with individuals that have this variant will likely infect others. Now, the good news is that vaccination, especially if you're boosted, protects really well against severe disease with this variant. You might have mild disease, but you won't get super sick. And those with previous Omicron infections likely still have some remaining immunity against this subvariant.
There was a pretty large study on ivermectin, something that a lot of people have been talking about, saying that it works if you've been infected with COVID-19. What did researchers find out, doctor?
Yeah, this large study, really well done study, really corroborates what we knew about ivermectin. We wanted it to be a cheap and good medication against COVID-19. And it's just not. It just doesn't work against COVID-19. There will be people that say, hey, I had Uncle Bob, he took ivermectin, he did fine. We'd call that coincidence. Uncle Bob was probably going to do fine if he didn't take ivermectin. These studies that look at hundreds, if not thousands of people who take a medication and then it shows no benefit, that's pretty conclusive. I wouldn't suggest anyone take ivermectin for COVID-19 at this point.
There's a new study also, another one on the Omicron variant that did a good job at avoiding the vaccine that was for children, but it did, however, prevent more serious illnesses. What did you see that was really prominent in that research?
Yeah, what I think we're doing is we're changing a little bit, how we talk about vaccines. Early in the pandemic, the vaccines were so effective that if you got vaccinated, you wouldn't even have symptoms of the disease. The real benefit of vaccines, though, isn't that. The real benefit of vaccines is that it prevents you from getting really sick, going to the hospital, or dying. And we're seeing that both with adults who are vaccinated against Omicron and now in the studies looking at even the pediatric vaccines. It may not prevent you from getting mild symptoms, but it will prevent you from going to the hospital. It'll prevent you from dying. And that's why I expect in the next couple weeks, there will be a pretty strong recommendation that those pediatric patients go out and get vaccinated so that their parents don't have to worry, if my kid gets COVID at school, are they going to be okay or not?
Exactly. Dr. Jeff Pothof, thank you so much for being with us and for clarifying everything for us to easily understand these complicated studies and issues. I appreciate you always. A reminder, you can find the latest on COVID-19 at tmj4.com/coronavirus wherever you are. The Brewers